A health alert this morning. Last week, actress Gabrielle Union shocked her fans when she announced she had suffered 8 or 9 miscarriages in her life. She also chronicled her lifelong struggle with infertility. Her announcement has people asking naturally, what about me? What can I do to make sure I can conceive? So joining us now is Dr. Kevin Winslow. Good morning, Dr. Winslow. Thank you for being with us.
Good morning.
A lot of questions when it comes to this topic. Let's first talk about miscarriages and how they can happen. And I feel that some women you hear about maybe having one and then having a successful pregnancy, and then other women like Miss Union, you hear about having multiple. How does this happen?
There are two main categories we think of in terms of recurrent pregnancy loss. We think of them in terms of early and late. The great majority of early losses are due to something genetically chromosomally wrong with the embryo. And most often that comes from an egg quality issue. For some reason, some women are born with a higher percentage of abnormal eggs than others. Later losses typically past about 10, 11 weeks. We think of other causes, clotting disorders, anatomic problems. But when somebody's had so many losses, often it is an egg quality issue.
And if somebody feels that they are having trouble getting pregnant, at what point do you recommend somebody thinking about seeing a specialist?
If the wife is more than 35, we generally recommend, if she's not pregnant in 6 months, to seek a reproductive medicine specialist. Because at the end of the day, the real issue is always the number and quality of the eggs left in her ovaries. We can get around any other infertility problems, but we can't put more good quality eggs back in the ovaries.
And with having trouble getting pregnant, the good news is there are options out there for women. Talk about some of those options, including, I know, IVF, and I think Miss Union mentioned something about IVF.
Yeah, in terms of treatments, again, depending on the actual issue, depending on, again, mom's age, her ovarian reserve is going to go a long way in terms of telling us how aggressive do we want to be with this patient. If it's somebody who's an older patient whose ovarian reserve is poor, we're going to get on with in vitro fertilization almost immediately, because we know, again, the real issue is remaining egg number and quality. Again, in terms of Miss Union's situation, there is now more and more IVF is used, again, to diagnose this problem and to treat it, with the idea that when we go through IVF, we create multiple embryos, and we can actually test those embryos to see which ones are chromosomally normal and which ones are not. So it's been a huge, huge benefit in terms of patients with recurrent pregnancy loss.
And it's incredible that we have that type of technology. And you mentioned after 6 months of a woman trying to get pregnant, looking to seeing a specialist. What if somebody is not at the point in their life where they're ready to get pregnant, but they have concerns about whether or not they will one day be able to? Do you recommend that somebody, even before they're considering pregnancy, see a specialist if they're interested, or is that something you think they need to wait further down the line to look into?
Well, if the patient has a history of maybe a mom who went through early menopause, a sister, the most important thing she can do is get her ovarian reserve tested, a hormone called anti-Müllerian hormone. That is going to, in a sense, give us an idea of her biologic clock. How much time do we have, and how aggressive do we need to be? If somebody, even in their 20s, their ovarian reserve is very poor, that's somebody who may be a very good candidate for egg freezing.
And that test that you just mentioned, is that something that they can get done at, say, an OBGYN, or do they have to go to a specialist?
No, they can get that with their OBGYN.
Okay,
yeah.
Very good information. Thank you so much, Dr. Winslow, for being with us this morning.